Assessing sperm morphology. Assessment of sperm morphology requires the preparation of well-made and properly stained slides. Slides are best made using a drop, or 10 ml, of thoroughly mixed semen and the traditional wedge smear technique. Slides should be made in duplicate and allowed to air dry. Rapid addition of fixative prior to drying denatures the seminal proteins, which can make it difficult to observe the sperm on a stained slide. After the slides have air dried, they should be fixed with ethanol or methanol prior to staining. Acceptable stains are Papanicolaou, PAP, Shore, Wright, or Giemsa. The WHO 6th edition's preferred method for slide preparation is 1. Make traditional wedge smears in duplicate. 2. Allow the smears to air dry. 3. Fix and stain with a PAP stain. For slides should be examined at 1000x for morphologic evaluation. 5. A 200 sperm should be classified on each of the replicate slides. 6. Acceptability of the duplicate results is based on the percent normal forms. The 95% confidence limits can be found in the World Health Organization, WHO, Manual, 5th edition. In order to standardize interpretations between laboratories, the WHO 6th edition lists specific criteria for identifying normal and abnormal sperm morphology. The term normal is perhaps better described as typical or fertile. A complete spermatozoon consists of a head, neck, and tail. The tail is composed of a mid-piece, principal piece, and end piece. Since the end piece is not visible using standard microscopy, it is not included in the morphologic evaluation. The areas evaluated are the head, and neck, and tail, mid-piece and principal piece, who recommends that 200 sperm be evaluated on each of the replicate slides. The image on the right is a very detailed schematic of human spermatozoa. Many of the elements listed cannot be visibly evaluated using routine light microscopy. Due to a number of variables associated with interpretation and the subjective nature of assessing sperm morphology, the current method for classification recommended by WHO 6th edition is to use the simple ideal, normal/abnormal identification of sperm. Ideal is defined as typical for sperm able to reach the site of fertilization. Both the head, and neck, and the tail, mid-piece and principal piece, must be normal, ideal or typical, for a sperm to be classified as normal. Some laboratories may also specify the section, head or tail, where the predominant abnormality occurs. If a fairly equal number of head and tail abnormalities are seen, mixed abnormalities may be reported. Certain defects are associated with male infertility, such as pinheads, no head, and heads lacking acrosomes. Borderline forms are considered abnormal. The following table outlines the criteria used to identify normal sperm morphology. Image shows the areas to be evaluated and the normal characteristics of spermatozoa. Classification of normal sperm morphology, WHO 5th edition. If separately classifying abnormal morphology, the types of defects are noted for the head, mid-piece, middle piece, and tail, principal piece, as outlined in the table below. Morphologic defects will generally indicate decreased possibility of successful fertilization of ovum. In some cases, the abnormalities are a fairly equal mixture of both head and tail abnormalities. Classification of abnormal sperm morphology, WHO 5th edition. Examples of abnormal sperm morphology. Leukocytes and spermatids, round cells. Leukocytes in semen are primarily neutrophils. They can be differentiated from spermatids by assessing stained cellular elements and by differences in nuclear size and shape. Leukocytes will stain blue while spermatids stain more pink when Papanicolaou, PAP, or right stain is used. A test for peroxidase activity can also aid in distinguishing granulocytes, the predominant leukocytes in semen, from spermatids. Granulocytes are peroxidase positive and spermatids are peroxidase negative. While leukocytes can be found in most semen samples, significant increases are thought to be associated with infection or inflammation. The arrows in the top image on the right point to two spermatids. The arrow in the bottom image points to a leukocyte, specifically, a neutrophil, among a few normal sperm. What test can be used to differentiate granulocytes from spermatids? Please select the single best answer. 1. Sperm viability. 2. Sperm count. 3. Peroxidase activity. 4. Sperm concentration. The correct answer. A test for peroxidase activity can distinguish granulocytes from spermatids. Granulocytes are peroxidase positive, and spermatids are peroxidase negative. Sperm viability is performed to determine if sperm are alive or dead in a sample. Sperm count provides the total number of sperm in an ejaculation. Sperm concentration is the number of sperm/ml in a semen sample. Which of the following depicts a sperm with a pinhead? Please select the single best answer. The correct answer. A pinhead, image 3, shows a very small head with minimal to no paternal DNA content. A double-head sperm is seen in image 1. Enlarged head, split tail are seen in image 2. Tapered head sperm are seen in image 4. A patient brings a semen specimen to the laboratory for analysis. He is asked what time the specimen was collected and responds that it was collected at about 10 a.m., 30 minutes ago. By what time should the evaluation of sperm motility be performed? Please select the single best answer. 1 by 11 a.m. 2 by 2 p.m. 3 at least by 5 p.m. 4 by 10 a.m. the following day. The correct answer. Sperm motility should normally be evaluated within 60 minutes of collection. If the specimen was collected at 10 a.m., motility should be evaluated by 11 a.m. If the specimen is not examined for sperm motility within 60 minutes of collection, it should be noted and explained in the final report. Which of the following images represents a normal sperm head? Image A. Image B. Image C. Image D. The correct answer. Image B represents a normal sperm head. A normal sperm head should be oval-shaped and smooth. The acrosome, light staining area, should occupy 40 to 70% of the head space. The width should be 2.5 to 3.2 m, and the length should be 3.7 to 4.7 m. The acrosomal area is condensed in image A, occupying less than 40% of the head space. The head is too small in image C and too large in image D. Which of these findings would be considered normal? Please select the single best answer. 1. Rounded heads. 2. Coiled tails. 3. Occasional leukocyte. 4. Thick tails. The correct answer. An occasional leukocyte is typical and not considered abnormal. Leukocytes are associated with inflammation or infection, and large numbers need to be reported. Rounded heads and coiled or thick tails are all abnormal. A newly trained medical laboratory scientist is viewing a wet preparation of semen for agglutination and motility patterns. She notes 15 to 20 sperm/agglutinate that are adhered onto mucus and other immotile sperm that are agglutinated to each other. What should her report entail regarding these findings? Please select the single best answer. 1 large, grade 3, with mixed attachment, grade D. 2 moderate, grade 2, with tangled attachment, grade E. 3 isolated, grade 1, with head-to-head attachment, grade A. For nonspecific aggregation present. The correct answer. A report of nonspecific aggregation present should be provided, and there are immotile sperm aggregated in nonspecific patterns and motile sperm adhering to mucus or debris. There is no need to grade or describe this type of agglutination. Grading system for other types of agglutination includes the following criteria. Which of the following instructions should be given to a patient collecting a semen specimen at home and bringing it back to the laboratory for semen analysis? Please select the single best answer. 1. Bring the specimen to the laboratory within 2 days of collection and keep it refrigerated. 2. Bring the specimen to the laboratory within 2 hours of collection and keep it on ice. 3. Bring the specimen to the laboratory within 1 hour of collection and try to maintain a temperature that is somewhere between room temperature and body temperature. 4. Bring the specimen to the laboratory anytime. The correct answer. The patient should be instructed to bring the specimen to the laboratory within 1 hour of collection and to try to maintain the temperature of the specimen somewhere between room temperature and body temperature, 20 to 40 degrees Celsius. Keeping the specimen in an inside pocket close to the body can be suggested during delivery in cold weather. Temperature extremes will diminish sperm viability and produce abnormal test results. It is important to the accuracy of the test that the patient be given specific instructions. You perform a semen analysis on a patient sample and obtain a low % motility result. If viability testing is not performed in your laboratory, what action should then be taken? Please select the single best answer. 1. Include a comment on the patient report, stating that the decreased motility may be due to either non-viable or non-motile sperm. 2. Report the motility as 20% without further testing or comment. 3. Discard the specimen and have the patient return to the laboratory to collect another specimen. 4. Assume that the low motility is due to non-viable sperm. The correct answer. If viability testing is not performed on samples with decreased motility, a comment should be included on the patient report, stating that the decreased motility may be due to either non-viable or non-motile sperm. The physician may then tell the patient to return to the laboratory or to the physician's office to recollect a specimen, but this would be the physician's decision. It is important to include the statement on the report if viability testing is not done to alert the physician to the possible reasons for the low motility. However, it should not be assumed that sperm are all non-viable. A semen specimen with a normal sperm concentration has a motility evaluation of 10% motile sperm. What additional procedure can be performed to determine the cause of the decreased motility? Please select the single best answer. 1. Repeat the motility test in 4 hours. 2. Examine a right stain smear. 3. Perform viability testing. 4. Repeat the sperm concentration on a new dilution. The correct answer. The correct answer is to perform viability testing. This is commonly performed using a dye exclusion method such as eosinogricin. Motility of 10% with a normal sperm concentration indicates that a large percentage of the sperm are not viable. Viable sperm will not stain with eosinogricin, and the heads will appear white or light pink against the dark background of the nigricin stain. Non-viable sperm will stain red or dark pink, as shown in the image. The percentage of viable sperm can then be determined. Repeating the motility test later will not increase sperm motility. All of the sperm, viable and non-viable, will stain if right stain is used. A 10% viability will not change if the sperm concentration is repeated. What information should be obtained from the patient and recorded and a semen specimen is brought to the laboratory for semen analysis? Please select the single best answer. 1. Time of collection. 2. Specimen volume. 3. Fasting status. 4. Type of container. The correct answer. The correct answer is to record the time of collection. Other important information includes days of abstinence. The specimen volume will be determined as part of the semen analysis. Fasting status does not affect this test. The type of container is apparent. A trained medical laboratory scientist begins preparing a sperm count using a hemocytometer. She diluted the specimen 120 with saline and then added a couple of drops of formalin. She proceeded to count all sperm present. Which of the following actions could lead to an inaccurate count? Please select the single best answer. 1. Heating the sample to 56 degrees Celsius for 5 minutes in a water bath after dilution in place of using formalin. 2. Adjusting the dilution if there are fewer sperm present. 3. Counting the sperm if the head is within the square but the tail is outside of it. 4. Counting all fully intact and partial sperm present within the squares being counted. The correct answer. Only sperm that are fully intact with a head and tail should be counted towards the sperm count. To inactivate sperm, you can either add a few drops of formalin or heat the sample to 56 degrees Celsius for 5 minutes in a water bath. The dilution should be adjusted accordingly when few sperm are present. Whether or not a sperm is counted in a specific square on the hemocytometer is based on the location of the head, the location of the tail is inconsequential. Upon receipt of a semen sample, the medical laboratory scientist noted a much smaller amount than normally seen in the container. After speaking with the laboratory assistant who received the sample, it was disclosed that the patient stated they had missed the container when first beginning to collect the ejaculate. The patient was able to collect the remainder of it into the container. Which of the following will be adversely affected upon analysis? Please select the single best answer. 1. Sperm count will be increased. 2. Specimen will be liquefied sooner. 3. pH is falsely increased. 4. Semen volume is decreased. The correct answer. The first part of the ejaculate is primarily made of sperm and acidic fluids. If this portion is not collected, the sample pH will be falsely increased or alkaline. The sperm count will be decreased, and the sample will not liquefy. The semen volume is made up of the second part of the ejaculate and, as a result, will not be decreased by missing the first portion collected.